I'm Dr. Bruce Cook, Chief of Staff at Dryden Regional Health Center. We are so close to receiving a COVID-19 vaccine in Dryden. This is an exciting opportunity for Northwestern Ontario and our community. I want as many people as possible to receive this vaccine, but also to feel comfortable and excited about it. With that, we at DRHC would like to share our medical expertise and our excitement with you. Please watch.
The new COVID-19 vaccine is a pretty cool scientific feat. Scientists, healthcare professionals, companies, and governments from all over the world came together to share evidence to produce this vaccine so we can get back to normal life. Usually the longest part of any vaccine development is recruiting volunteers, but developers were able to use existing registries of volunteers so they didn't have to go through that process of recruiting those volunteers. Both the Pfizer and Moderna vaccine currently approved in Canada are 95% effective.
The vaccines use a known technology incorporating mRNA, also known as messenger RNA. Messenger RNA teaches our cells how to make a protein from the virus, which triggers our immune system to create antibodies. And these antibodies then help us fight the infection if the real virus enters our body.
To go more in depth about the COVID-19 vaccine, we have to talk about the spike protein on the COVID-19 virus. This spike protein is how the virus attaches to our cells and causes infection when we are exposed to the virus. mRNA vaccines work by replicating a very small part of the virus, in this case, the spike protein. When we get the vaccine, this teaches our cells to make only the spike protein. Our body recognizes this as foreign, so our immune system produces antibodies to attack the spike protein only. That way, if we're exposed to the virus, our body already has the antibodies to attack the spike protein and kill it. This way, the virus can't infect our cells and we can't develop the COVID-19 infection. Our immune system is very smart and keeps these antibodies for life. And what happens to the mRNA? It is very fragile and it breaks down quickly, which is why the vaccines need to be transported in very cold temperatures.
To sum it all up, this technology does not affect our DNA because mRNA does not enter our cell nucleus and it does not give us COVID-19.
So get vaccinated!
My name is Angie Barr. I'm a registered nurse in the emergency department here at Dryden Regional Health Center. I'm going to get my COVID-19 vaccine because it's the least I can do. I want to be a part of something that helps to ease the suffering endured by our healthcare professionals and frontline workers around the world.
Hi, I'm Dr. Ross. I'm a registered nurse and the CEO of Dryden Regional Health Center. I'm going to take the COVID-19 vaccine when it's available to me because I want to protect our community, the staff and patients at the hospital, my friends, my family, and myself. I'm looking forward to being able to see my parents and other family. I'm looking forward to my children to be able to see their grandparents, and I'm really looking forward to meeting the new babies that have been born into my family during the pandemic that I haven't got to see yet. Thank you.
I'm getting vaccinated for my mom and the community.
The COVID vaccine for my patients and for my family.
The COVID vaccine because I want to do my part in ending the pandemic, protecting those who are vulnerable as well as my family.
Hi, my name's Chuck Schmidt. I'm the fundraising and recruitment manager at the Dryden Regional Health Center. I'm going to get the COVID vaccine when it becomes available for a couple of reasons. First and foremost, I don't want to get sick. I don't want anybody I know to get sick. I want to protect my family and my friends. I want to keep my community safe, and I don't want to occupy a hospital bed if I don't have to. So in my mind, it makes sense to get vaccinated when it becomes available.
Hi, I'm Jennifer Millard, registered nurse of the Dryden Area Family Health Team. I am going to get my COVID vaccine. I want to protect myself, my family, my friends, and my patients.
Hi, my name is Reagan McGinn, registered nurse with the Dryden Area Family Health Team, and I cannot wait to get my COVID-19 vaccine.
I'm Judy Green, chair of the hospital board. When it's my turn, I am going to get the COVID vaccine because it's not about me. It's about protecting our community and our frontline workers. I'm trusting the science as we find the road to normalcy, but I will be continuing to wear my mask and respect physical distancing.
I am excited for the COVID-19 vaccine because it is the first step forward in returning my family to the way we want to live our lives. There is so much out there waiting for us. Travel, sports, university, family gatherings, and much more. This is an amazing sign of progress for all of us. let's get the vaccine.